Good morning, everyone, and thank you for watching the April 16th City of Janesville COVID-19 Community Briefing. This briefing is provided Monday through Friday at 8:30 a.m. My name is Mike Bachmeyer, and I am the Planning Section Chief for this operational period. We'll begin this morning with a review of our incident objectives for the city's COVID-19 response. Safeguard the community, including our residents, businesses, and visitors. Deter the spread of COVID-19 within our capabilities. Provide essential services to the community. And safeguard City of Janesville employees and preserve our city service power. We'll now hear from other members of our EOC leadership team, and we're going to begin with Situational Leader Maggie Darr.
Thank you, Mike, and good morning, everyone. I'm Maggie Darr, Situation Unit Leader for this event. As of yesterday, Wednesday, April 16th, the Wisconsin Department of Health Services reported that there are 3,721 confirmed positive cases of COVID-19 in the state of Wisconsin. There are 62 confirmed cases in Rock County, which is an increase of 3 from the previous day, and there have been 4 deaths in the county. We continue to monitor closely our staffing levels, and if you're wondering why this is important, which I've heard that question, as Mike mentioned, one of our incident objectives is ensuring we can continue to provide essential municipal services. And so we would really be in a world of hurt if there was a large outbreak within our police department, our fire department, public works, our transit system, or frankly, our finance office, our clerk's office, our IT office, etc. And so it's really important that we are monitoring our staffing levels to ensure that we can continue to provide those services. So as of yesterday, Wednesday, we had 48% of our employees that were reporting to their assigned work location. We had 19% of our employees working remotely, and we had 32% of our employees that were out of the office, whether that's because they weren't assigned to duty or they were out for other planned reasons. Continue to monitor our levels of personal protective equipment, or PPE. And as I stated yesterday, we are in pretty good shape, and this is really a testament to our leaders in all of our departments, divisions, and offices for early on identifying their needs, and then to our EOC logistics team for really hitting hard, trying to secure PPE to meet those needs and coming up with creative solutions. We also continue to keep in close contact with all of our partners in the medical community, other governmental agencies, schools, assisted living facilities in the community, and many more partners. Thank you.
Thank you, Maggie. Next, we'll hear from Economic Development Director Gail Price.
Gail Price, Economic Development Director. The Economic Development Office continues to be a resource for businesses in the community. We're here to help you with strategies to get through this pandemic and remain open through and after the pandemic is over. We continue to work with businesses to connect them with banks that can provide SBA loans through the PPP program. We are aware that banks are starting to stop taking applications right now just because there's anticipation that the fund will be expired by the end of the week. Now, we continue to reach out to our Congress members to encourage them to replenish that program. We do anticipate that if that is replenished, that the banks will start taking applications again. So feel free to give the Economic Development Office a call, 608-755-3059. We'll be glad to assist. The county's COVID-19 Small Business Loan Fund will open up next week. That'll be an online portal. There will be additional information released here shortly that will have a link to our growjanesville.com website. If you go to the banner at the top, you can connect up with our COVID response page, and that has the various programs. We'll have that information posted there. We're also seeing stimulus money that's being released out to everyone. If you've got direct deposit that is being directly deposited into your account, we encourage you to spend that money locally. So if you spend it locally, it gets recirculated locally and actually goes farther into the economy. So certainly support your small businesses here in Janesville. Some of the other things that the Economic Development Office is doing, we're starting to plan for what this can look like after the pandemic. So we're talking to the governor's office, we're talking to WEDC about how businesses can reopen, what that might look like. Can restaurants reopen, say, at half occupancy and practicing social distancing and things like that? So we want to continue to look forward to what that will look like at the end and help our business community reopen as soon as possible. So there'll be more additional information forthcoming. We continue to work on this. And again, if you've got any questions, feel free to give us a call, 608-755-3059. We'll be happy to help. Thank you.
Thank you, Gail. Very helpful information. Next, we'll hear from Public Information Officer Alan Luckett.
Good morning, Janesville. Be sure to go to our website for information that'll help you through all your questions, and at least get you in touch with the right people. Keep in mind our city's website is ci.janesville.wi.us, and there you can actually get to our Facebook and Twitter account as well. If you'd like to sign up for press releases, you can go to our website, and then it's /email lists. The COVID specific information is available on our website. So if you go to ci.janesville.wi.us, at the top of the page, there's a COVID-19 link right there. So just click on that ribbon up there, and that will take you to our archived briefings that we have, some community resources, frequently asked questions, as well as CDC information, business recovery information, and more. The City of Janesville trusts government-sanctioned sites such as the CDC, Wisconsin Department of Health Services, FEMA, and others. So please go to those trustworthy sites for up-to-date information, as well as our website. If you have questions, please call the city's community support hotline daily from 8 a.m. to 4 p.m. at 608-373-6027. Please share this information with your family and friends, community groups, and social networks, and anyone else who can benefit from this. Also, we encourage people to use social media. So if you have a Twitter account, you can you can post things that are hashtag one positive thing or hashtag Janesville Strong in order to kind of help support our community through these times. Thank you very much.
Thank you, Alan. Next, we'll hear from Finance and Administration Section Chief Kelsey Bannock.
Good morning, Kelsey Bannock, Finance and Administration Section Chief. The EOC Admin Finance Section is documenting all personnel and operating expenses related to the city's COVID-19 pandemic response for potential reimbursement from the FEMA Public Assistance Program. The FEMA Public Assistance Program reimburses 75% of eligible assistance expenses, while the state has agreed to reimburse 12.5% of eligible assistance expenses. The EOC response team has logged 4,363 hours to date, and we have captured expenditures of 823,714 hours and 98 cents. Thank you.
Thank you, Kelsey. Next, we'll hear from Safety Officer Captain Tom Bruner.
Tom Bruner, Safety Officer. We want to continue to emphasize washing your hands often with soap and water. When soap and water aren't available, we still recommend using a hand sanitizer with at least 60% alcohol. This is especially important after you've been in a public place. We want to continue to warn you about touching your eyes, nose, mouth, and with unwashed hands. Again, talking about social distancing, we should avoid close contact with people who are sick and create a space between each other, again with that 6-foot social distancing area. We want to emphasize formulating a plan in your home if somebody should become sick. If you choose to wear a fabric, non-standard mask or any other mask in public, continue to maintain 6 feet social distancing. The CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain, such as a grocery store. CDC is additionally advising the use of simple cloth face coverings to slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. The cloth face coverings recommended are not surgical masks, nor are they N95 respirators. Those are critical supplies that must continue to be reserved for healthcare workers and other medical first responders as recommended by current CDC guidance. Remember to wash your cloth facepiece on a regular basis. Workspaces and residences should be thoroughly cleaned with approved EPA cleaners, especially those high-touch surface areas. Thank you.
Thank you, Captain Bruner. Next, we'll hear from Incident Commander, Fire Chief Rhodes.
Good morning, Janesville. Just a big thank you to the retail workers today and practically every day. I go to the store once a week and I see employees stocking our shelves. I see them working at our gas stations and they're checking us out at the register, and I see everybody not wearing their mask. Please try to wear a mask, wear a bandana. I can't imagine the amount of courage it takes for somebody to go to the store to work to stock our shelves because they're being exposed to many, many people. And I am so respectful of that. What we can do as a community, as a team, together, is wear a simple face mask. Let's protect yourself and protect them. Remember, it keeps the contagion in you, which limits our spread, and which can protect the other people or help protect the other people in close proximity. If you don't have a face mask, go to the city's website, the green ribbon up top, go in the middle, click on that, go in the middle of the page, go to the CDC bullet, and it shows you how to make a simple face mask. Please, please start using that. It is my hope that this weekend when I go and do my weekly run for resupply, I see more masks. It is important to practice safer at home. I know everybody is seeing peaks and the data is down from what is projected, and that means safe at home is working. We can't get excited and go, man, I cannot wait till they open up everything. I'm going to go crazy, right? You've got to manage your own expectation. You got to temper what you think you'll do. We have to slowly reemerge from safe at home because there is a potential for a second wave. And so you mentally need to be thinking about a second wave. If we work together as a team and we re-engage or re-energize our society slowly and intelligently and not emotionally, then maybe we can avoid another wave and maybe we can get out of this sooner than later. Remember, we're running a race. We're in the middle of the race. We've ran over this terrain. If we decide to quit the race, and that race is safe at home, social distancing, wear your face mask, we have to rerun the race and run over the same terrain again. So the race gets longer and longer and longer. Stay in the race. Pace yourself. Please pace yourself. Current operations in the Emergency Operations Center today, we are going to a level 3, which means we're going to an enhanced watch. The selective sections of the EOC will be active still. That is the operations section. That is public information. That is a situation unit leader. And that is our community hotline. We're doing this because we're paying attention to the data. We're looking at the activities in the city. And we're watching and monitoring our staffing, which is critical because that is our city power and that's how we serve you. We know we're going to be in this for months and months, maybe up to 18 months. So we have to manage the amount of time, the stress, and we have to pace ourselves through this. So we think it's a good time to go to a level 3, enhance our watch, and monitor the situation. However, that doesn't mean we're ready to surge back up to a level 2 or level 1. Everybody is highly, highly aware of their situation, and we are positioned to reconstitute the full EOC at a moment's notice and at any given time. Please remember that if you have somebody in your neighborhood that thinks that they may need help or assistance, call our community helpline or our hotline at 608-373-6027. And as I close here, be mindful of the 3 goods. Good food, good sleep, good exercise. You're in your new norm. So now that you're in your new norm, do one positive thing, and as always, please give each other grace. Thank you.
Thank you again, Chief Rhodes. And next we will hear from City of Janesville City Manager Mark Freitag.
Thanks, Mike, and good morning, City of Janesville employees, EOC members, and certainly any members of the community that are listening in and able to watch today. I would tell you that one of the nice things that we got yesterday, a surprise out of the county, was a new tracking and projection system. It's posted on the county's website, and we'll make sure that we get it pushed out via social media and onto our own website. But it provides for some estimates that the county health department is looking at as far as number of cases and hospital bed use as we move forward. And I found it very helpful to just appreciate kind of where we're headed. I would tell you that the model estimates for the number of people who could be infected with COVID-19 in Rock County. They have multiple different kind of graphs and bars that show how that could look at given different assumptions as far as how this is going to work its way through the community. The black line on here is essentially knowing what we know today. This is what they think is going to happen as it moves forward. And so looking at that black line for number of people who could be infected with COVID-19 in Rock County, they're estimating that we would peak on May 16th at approximately 1,640 people. And that is based upon what they know today. That's an estimate. Things could change. The other thing that is provided on there is hospital beds, and that we've talked about before. It's certainly one of those critical resources that we need to monitor, but they're projecting as based upon what we know currently today with that projection is on May 14th, we would see an occupancy of about 197 beds in Rock County being utilized. And so, what you'll see on this thing is you'll see, several different graph lines, and that's based upon, how coronavirus develops in Rock County. And again, they're projections, but there's something that we plan against so that we can make sure we're prepared when those time periods hit. I would tell you that from my military background, I learned something as a young second lieutenant, and that's when you plan to fight an enemy, you plan your operation based upon the most likely enemy course of action. On this chart, that would be the black line. But you also have to be prepared to meet an enemy that's going to come at you with the most dangerous course of action, and that would be the red lines on this case. And so we're kind of stuck in a position of, do we plan for most likely and forget about that most dangerous? Absolutely not. We plan for the most likely, and we have plans and preparations, contingencies, branches, and sequels to address those most dangerous courses of action. And so I would remind everybody that coronavirus gets a vote. We've already discovered on a global stage that it's elusive, it's adaptive. Certainly we can't see it. And so people, continue to comment to me, when is this going to be over? What does this line look like? And frankly, we've got an organism out there that's adapting every day, and so that this reality is going to adjust. Not one single one of these projections is going to play out perfectly accurate when we look back on it at the end of all this. So just understand that things will change. It's a dynamic environment, but we're going to get through this. And the one thing I would continue to reiterate is the City of Janesville is prepared. We're planning. We have contingencies for worst case scenarios, and you're in good hands with the City of Janesville. We got a great incident commander. He understands the business, and I have full faith and confidence in Chief Rhodes to make good decisions to get us through this pandemic. And so, the City of Janesville's on it. We're Janesville strong, and we're going to be victorious when this ends. Thanks.
Thank you, Mark. This has been the April 16th City of Janesville COVID-19 Community Briefing. This briefing is brought to you Monday through Friday at 8:30 a.m. Thank you so much for tuning in.